15 bad habits that are ruining your kidneys. Stop now if you don't want your kidneys to fail. Hello everyone. We all know the importance of maintaining good health, but sometimes we accidentally doing bad habits that can seriously damage our precious organs. One of them is our kidneys. This bean-shaped friend is like a detoxification factory. It plays a vital role in detoxing toxins from our blood and maintaining our body's fluid balance and regulating blood pressure. It's hard to notice when your kidneys are silently being destroyed, because even when they're 80% damaged, they can still do their job. Here are some common everyday habits that are silently damaging your kidneys, and by the time you find out something's wrong, it's often too late. The kidneys are incredibly hard-working organs. They absorb minerals and nutrients, produce hormones, act as a filter for toxins in the blood, produce urine, etc. So what happens when your kidneys are damaged? A series of serious problems will happen to you, such as anemia, bone disease, heart disease, hyperkalemia, water retention in the body leading to edema, etc. Therefore, be careful with the habits that are contributing to the destruction of your kidneys every day by avoiding the following habits. 1. Holding in urine. A very common bad habit. Indeed, in our lives, everyone has to hold urine a couple of times because they cannot find a place in time. However, if this condition keeps continuing too many times, it can lead to dangerous complications. First of all, your bladder is under a lot of pressure from the amount of stagnant urine that is not excreted. Over time, it will lose the ability to control the external sphincter muscles of the bladder, causing urine to leak, creating the root cause of a series of kidney diseases. Among them are common risks, such as urinary tract infections, increasing the risk of inflammation leading to impaired kidney function, or causing an imbalance of salt and minerals in the urine, causing the formation of urinary stones. Large stones over time can also lead to dilation of the renal pelvis and loss of kidney function, kidney failure. In addition, complications are faster. Urine in the bladder will tend to flow back to the kidneys and cause kidney failure. 2. Drinking soda. Let's come to the second habit, drinking too much soda. One of the most worrying problems with the kidneys is the sugar content in soda. Some research shows that drinking more than 4 cans of soda per week can increase the risk of chronic kidney disease. Not only soda, but any food with a lot of sugar also increases blood sugar. High blood sugar over a long period of time can damage the blood vessels in the kidneys, increasing the risk of kidney disease. One thing to note is that even drinking fruit juice with a lot of sugar is very harmful to kidney health, because fruit juice contains a lot of sugar, while the large amount of fiber in the fruit that is discarded plays an important role for the body. Therefore, instead of drinking fruit juice, eat fruit to protect your health. Another ingredient found in many types of soda is phosphoric acid. Research shows that sodas containing phosphoric acid can change the composition of urine, increasing the risk of kidney stones and chronic kidney disease. Therefore, many health agencies recommend that people with kidney stones or kidney disease avoid drinking soda. Even for healthy people, drinking 2 or more cans of soda a day increases the risk of developing chronic kidney disease. 3. Staying up late. Many people think that staying up late only affects the nerve system, causing mental stress, without knowing that this is an extremely dangerous habit to every part of our bodies. It quickly destroys organs, including the liver and kidneys. Sleeping is the time for organs to rest and recover after a day of activity. The same goes for the kidneys. When you stay up late, your kidneys will fall into a state of stress, leading to a decline in kidney function. Staying up late will stimulate some hormones in the body to constrict the blood vessels to the kidneys, causing local ischemia to the kidneys. This will lead to a decline in kidney function over time. In addition, staying up late also causes diseases such as diabetes and high blood pressure. These are also 2 causes that many people suffer from, leading to a decline in kidney function. Therefore, change to a healthy lifestyle, sleep properly, and get enough sleep to help the mind stay alert and reduce the risk of decline in function for organs, including the kidneys. 4. Lack of exercise, a bad habit of many people. not only harms the kidneys, but also many other organs of the body. Lack of exercise will cause poor circulation and excretion of urine, so the flow rate of urine is not strong enough to wash away the sediments. Over time, will form urinary stones, indirectly causing kidney failure. In addition, lack of exercise will also increase the risk of diseases such as blood pressure, cardiovascular disease, diabetes, also indirectly causing kidney failure. A good way to protect your kidneys is to exercise regularly. A comprehensive study published in 2013 in the Journal of the American Society of Nephrology found that postmenopausal women who exercised regularly reduced their risk of developing kidney stones by up to 31%. Exercise is good for people with high blood pressure, improves sleep, and strengthens muscles, while reducing risk factors for kidney disease. According to a 2019 study, people with kidney disease should exercise lightly for 150 minutes/week. You can walk, run, dance, or cycle for about 20 minutes a day. In addition, exercise also releases the happy hormone endorphin, improving your mood. 5. Not drinking enough water. When you are dehydrated, the amount of blood flowing through the kidneys will decrease significantly. To ensure blood filtration efficiency, the kidneys will have to work harder. This will make the kidneys tired and lose function over time. In addition, one of the main functions of the kidneys is to regulate the concentration of electrolytes in the body. Electrolytes such as sodium, potassium, and calcium are important for the functioning and maintenance of fluid balance in cells. However, when the body is dehydrated, this balance is disrupted. The concentration of electrolytes in the blood will no longer be at a healthy level. The kidneys will have to work harder to balance this electrolyte concentration. One of the important things for the kidneys to function is to be hydrated. Otherwise, toxins begin to accumulate in the blood because there is not enough fluid to carry them through the kidneys. The National Kidney Foundation recommends that you drink at least 8 to 10 glasses of water a day. To check if you are drinking enough water, you can look at your urine. If it is light in color, it means you are hydrated. If it is dark in color, you should drink more water. In addition, dehydration will also lead to more concentrated urine. When there is not enough water to dilute the waste products in urine, it becomes concentrated. This condition manifests as urine that smells stronger and is dark yellow instead of straw or white. Concentrated waste products in urine can increase the risk of kidney stones and urinary tract infections. In addition, frequent dehydration also contributes to kidney damage. Over time, lack of water will damage the kidneys, thereby causing the kidneys to no longer function at an optimal level. Many studies have found that prolonged dehydration can increase the risk of developing chronic kidney disease. As a result, the kidneys can suffer irreversible damage. It is important to note that you should not wait until you are thirsty to drink water. Health experts recommend drinking water regularly to keep the body hydrated, thereby helping the kidneys and many other organs to function at an optimal level. It should also be noted that drinking too much water will also make the kidneys work harder and also pose risks of kidney failure. So drink a decent amount. An adult should drink at least 2 liters of water a day. However, this amount of water is not fixed, but can change depending on body weight, exercise intensity, weather, and some other factors. 6. Excessive salt consumption. Salt is an irreplaceable spice in every meal. Salt is often used to add flavor to dishes or as a food preservative. In daily life, salt is lost through the body's excretory mechanisms, such as sweating, going to the toilet, tears. Therefore, we often compensate for the amount of salt in the body through food and dishes. However, many people have the habit of eating salty foods, adding too much salt and spices to food when processing, cooking, when dipping, mixing in meals, leading to excess salt in the body. Although salt is essential for the body, eating too much salt causes serious harm to each person's health, especially causing kidney failure. Consuming a diet high in salt can contribute to high blood pressure and increase the risk of kidney damage. Eating too much salt causes the body to absorb a lot of water due to thirst, leading to increased blood circulation to the glomerulus. forcing the kidneys to work harder to filter the blood, which in the long run will cause kidney failure. Limit your intake of processed and packaged foods, which are often high in sodium. Instead, opt for fresh, whole foods and season your meals with herbs and spices for flavor. 7. Using too many drugs and supplements. We all know that the liver and kidneys are two organs that process toxins and unnecessary substances in the body. Therefore, even the use of certain medications can cause side effects that can affect the function of the liver and kidneys. Or supplements, sometimes our body lacks, will cause some problems. We need to supplement through these foods. However, at a dose exceeding safety, it will become a burden on the liver and kidneys. Excessive use of vitamin C can cause kidney stones. High daily doses of B vitamins, such as folic acid, B6, and B12, can impair kidney function in people with diabetes. Taking large amounts of curcumin while taking immunosuppressants can cause kidney damage. In addition, taking too much vitamin D for a long time can lead to irreversible kidney failure. So please consult your doctor before using any medication or supplement to ensure safety. 8. Consuming too much protein. According to a study conducted at Harvard University, too much protein in the diet can affect the kidneys. When we digest protein, the body produces ammonia, a toxin that the kidneys have a hard time neutralizing. This means that the more protein you eat, the harder your kidneys have to work, which can lead to kidney failure. For people who already have kidney damage, it is necessary to limit the consumption of too much protein, which can make the kidneys work harder and increase the risk of kidney failure. 9. Lack of vitamin B6 and vitamin A. Kidney function depends on a healthy diet, especially one that contains certain nutrients. According to a study conducted at the University of Maryland, a deficiency in vitamin B6 increases the risk of kidney stones. Because vitamin B6 reduces the amount of oxalate in the urine, it reduces the possibility of oxalate stones. Vitamin A also helps keep the urinary system regulated to prevent the formation of kidney stones. The required amount is about 5,000 IU of vitamin A and 20 to 30 milligrams of vitamin B6 per day. The richest food sources of vitamin B6 are fish, beef liver, potatoes, starchy vegetables, green beans, and non-citrus fruits. 10. Drinking too much alcohol. The toxins in alcohol not only damage the liver, but also impair kidney function. According to the British Kidney Foundation, regularly drinking too much alcohol doubles the risk of kidney disease. Drinking too much alcohol also increases blood pressure, a common cause of kidney disease. Drinking too much alcohol, more than 4 glasses at a time, can lead to a serious condition called acute kidney injury. This occurs when toxins from alcohol build up in the blood rapidly, and the kidneys cannot maintain the proper fluid balance. Alcohol can also indirectly increase the risk of developing a urinary tract infection, UTI, which can cause kidney pain or abdominal pain. At first, you may not have any symptoms of kidney damage from regular drinking. As the kidneys become overloaded, they become less able to filter the blood and maintain the proper fluid balance in the body. People with kidney damage from alcohol may experience the following symptoms: fatigue, swelling of the legs, ankles, and feet due to fluid retention, loss of appetite, changes in urine, kidney pain. When these symptoms occur, the patient needs to see a doctor for timely medical intervention. Acute kidney injury from binge drinking usually goes away within a few days. The damage can often be reduced if you stop drinking to allow the kidneys to recover, but sometimes permanent damage can occur. Regular heavy drinking can eventually cause chronic kidney disease, CKD, which can lead to kidney failure, eventually requiring dialysis or a kidney transplant to sustain life. Heavy drinking also reduces your chances of a successful kidney transplant. Heavy drinking can also cause liver damage such as cirrhosis or liver cancer, making the kidneys work harder. Kidney disease can be complicated by coexisting liver disease. 11. Smoking. What is the relationship between tobacco and the kidneys? Many people still think that smoking only harms the respiratory system, such as the lungs or bronchi. According to WHO, cigarette smoke contains more than 7,000 toxic substances, of which 60 are carcinogens, especially nicotine. This is a pure liquid with an unpleasant odor and bitter taste, easily soluble in water and easily penetrates the body through the mouth, respiratory tract, and even through the skin. Therefore, when smoking or living with a smoker, the smoke inhaled through the lungs, absorbed into the blood, and accumulated over time becomes a condition to destroy many organs in the body, such as causing cardiovascular diseases, chronic obstructive pulmonary disease, osteoporosis, lung cancer, deformed sperm, hearing loss, cataracts, etc. Cigarette smoke can also directly harm the kidneys, affecting the blood filtering ability of this organ. Toxic substances in cigarettes can seriously harm the kidneys in many ways, including increasing the risk of developing kidney cancer, damaging the cardiovascular system, leading to poor blood flow to the kidneys, causing kidney damage over time, and accelerating the progression of kidney disease due to diabetes and high blood pressure, which are common causes of kidney failure. Specifically, when smoking, nicotine and dangerous chemicals enter the body, causing high blood pressure and heart rate, affecting the body's veins and arteries, reducing blood flow to the kidneys as well as other organs. Toxic substances in cigarettes cause peripheral artery disease, narrowing the blood vessels in the kidneys, and at the same time causing arteriosclerosis, thickening and hardening of the arteries, including the renal arteries, accelerating the progression of kidney failure. Chemicals in cigarette smoke can penetrate the blood, causing kidney stones more easily than non-smokers. Kidney stones have many causes, often due to a sedentary lifestyle, not drinking enough water or poor nutrition. However, according to many research shows that smoking is one of the leading causes. Therefore, one of the best ways to protect kidney health is to stop smoking. When quitting smoking, the body's natural functions can restore and slow down the progression of kidney disease, improve quality of life, and reduce the risk of dangerous diseases for people around when exposed to passive smoking. 12. Magnesium deficiency. Magnesium is one of the minerals that plays an important role for humans, participating in about 300 biochemical reactions in the body. Magnesium is also very important for heart function, reducing the heart's oxygen demand while the body is resting, as well as during work and exercise, enhancing heart function and preventing cardiovascular diseases. Magnesium also has the effect of regulating blood sugar levels and supporting blood pressure stabilization. Magnesium is essential in the process of creating muscle and liver glycogen from blood glucose and participating in the structure of tissue, including bones. Some foods with high magnesium content should be supplemented, such as chocolate, avocado, and nuts. However, if you are suffering from kidney stones or have a history of kidney stones, you should limit your chocolate intake because the oxalate content in chocolate is very high, which can lead to the formation of calcium oxalate stones. 13. Lack of sleep. According to Dr. Michael Soley, professor of cardiology at the University of Toronto, kidney tissue is regenerated at night when we sleep. Therefore, if your sleep is constantly interrupted, the kidneys will be directly damaged. For people with chronic kidney disease, poor sleep can make their disease worse. A study included 432 adults with chronic kidney disease. Researchers tracked their sleep habits for 5 to 7 days using wrist-worn monitors. They then followed their health for an average of 5 years. Of the participants who slept an average of 6.5 hours a night, 70 developed kidney failure and 48 died, the study found. After adjusting the data so that they weren't affected by other risk factors like weight or heart disease, the researchers linked each additional hour of sleep at night to a nearly 19% lower risk of kidney failure. Short sleep and fragmented sleep are significant but understudied risk factors for the progression of chronic kidney disease, said study author Ana Ricardo, PhD, of the University of Illinois at Chicago. Our study adds to the accumulated knowledge about the importance of sleep for kidney function and highlights the need to design and test clinical interventions to improve sleep habits in people with chronic kidney disease. 14. Not treating common infections. Sore throat can cause kidney failure, which sounds unrelated but in fact has many hidden risks. One of the common causes of kidney failure is glomerulonephritis. In the case of streptococcal pharyngitis, usually group A beta hemolytic streptococcus. At this time, the body will produce antibodies against the bacterial antigen. The antigen-antibody complex circulating in the blood will deposit in the glomerulus and cause glomerulonephritis. Therefore, to protect the kidney, it is also necessary to protect the health of other organs. Treat common infections to avoid bigger complications. 15. Not taking necessary medications. If you have high blood pressure and/or type 2 diabetes, two very common diseases today, you have to use medication to treat the disease. The drugs help lower blood pressure and control insulin levels. Therefore, if you stop taking them, your kidneys will almost certainly be damaged. In addition to the above habits, there are also some other habits that are not good for your kidneys. For example, excessive exercise can cause muscle damage, muscle destruction, and release of substances from the muscles. This can lead to renal tubular obstruction and cause acute kidney injury, requiring hospitalization for treatment. Sometimes the condition progresses so severely that several dialysis sessions are required for treatment. For patients with urinary stones, when there are signs of urinary tract obstruction causing urine retention and dilation of the renal pelvis, it is also important to pay attention. Quickly treat the stones and clear the flow of urine to avoid acute kidney failure. In addition, to help keep your kidneys healthy, you can watch more videos about foods that are good for your kidneys. Above are some bad habits that damage your kidneys. If you find it valuable, please share it with your friends and relatives to avoid bad habits. Don't forget to give this a like and subscribe to the channel so you don't miss the latest videos.